Hi guys, Dr. Bill here. So I just saw a patient who had been seeing another doctor before me about her thyroid, and she was on levothyroxine generic, and when she saw her other doctor in July and labs were done, her TSH was pretty suppressed. It was like less than 0.1, I think. But her free T4 and free T3 were fine and she felt fine. But her doctor looked at her TSH and said, well, it's pretty suppressed, we should lower your dosage. So they lowered her dosage a little bit and she feels worse. So this brings up the question of, are we treating patient symptoms or do we just treat TSHs? Now, the Endocrine Society and internal medicine folks, they really frown on suppressing TSHs, and so do even some people in the integrative and functional medicine community. Some of them say the same thing. But what I find is that if you base your treatment decisions just on the TSH, you're going to have a lot of unhappy patients because they're not going to feel their best. So the TSH is not necessarily a reliable indicator of what the person's thyroid status is, because the pituitary gland up here at the base of the brain doesn't even necessarily know what's going on in the tissue level, right, in the cells. So plus the enzyme that converts T4 to T3 up here is a different enzyme than converts it in the rest of the body, so there's a discrepancy there as well. So we really don't just depend on TSH. I mean, we pay attention to it, but we don't base treatment decisions on it. I always tell patients that the labs tell us what we can do with your thyroid, not what we have to do. What we do is dependent upon how the person's feeling. Now, of course, not all symptoms are related to thyroid. Obviously, there's a lot of other things, but we have to consider the fact that we're not treating numbers, we're treating the person. So the other thing that came up in this is that she's on generic levothyroxine, which I would say for the majority of people is okay, but not always, because sometimes just a little bit of a change in the T4 can make a difference, and generics have to be within 10% high or low of the brand name stuff. So what I did suggest to her, because we are talking about making some small changes, was to think about going on brand name Lavoxyl instead of generic. The other thing we talked about was maybe adding a little bit of T3, which is liothyronine, because she's only ever been on T4. So a lot of patients will feel better if you add a little smidge or even a significant amount, a more significant amount of T3 to their regimen. So we kind of touched on that a little bit as well. And I think that's true for a lot of patients who aren't doing that well on just T4. We add a little bit of T3 and it can perk them right up. And that has to do with maybe T4 to T3 conversion issues or something we call T3 resistance, stuff like that. So anyway, just wanted to share that with you today, and thanks for listening. Take care.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.